Welcome to Your Anxious Child, 5-Minute Solutions, a podcast dedicated to providing practical advice and support for parents of anxious children. This advice is informational in nature and not a substitute for a consultation with a licensed mental health professional. And now, here's your host, Dr. Edward Plimpton.
Welcome back to Your Anxious Child, 5-Minute Solutions and Interviews with Experts. Today, I am very excited that we are going to be talking about BFRBs, or body-focused repetitive behaviors, skin picking, hair pulling, and the like, with Dr. Jennifer Gola and Dr. Reinardy, who, along with Dr. Marla Deibler, have just written, hot off the press, a book for children and adolescents, Free to Be Me with a BFRB. So, thank you guys for talking today with me about your book. And I wonder if you could just sort of introduce yourselves a little bit and tell us a little bit about yourselves before we plunge into talking about your book.
Sounds good. Do you want to kick us off, Dr. Gola?
Sure. Thank you for having us, Dr. Plimpton. Like Dr. Plimpton said, I'm Dr. Jennifer Gola. I'm a clinical psychologist at the Center for Emotional Health. I specialize in OCD, body-focused repetitive behaviors, and anxiety disorders in kids, adolescents, and adults. And I've been at the practicing over here for about 11 years.
Okay. And I'm Dr. Reinardy. I've specialized in body-focused repetitive behaviors, OCD, Tourette syndrome, and related conditions for a little over 25 years now. Really am excited to be here today. Thank you so much for having us to talk about one of our favorite topics. So excited to see the questions that you have and share this resource with your listeners.
So I wonder if we could and congratulations on your book, by the way. So I wonder if we could just kind of begin with an introduction about just what are um, body-focused repetitive behaviors and how prevalent they are, and when do we see kind of a typical age of onset?
Go ahead, Dr.
Those-
Reinardy.
Yeah, those are great questions. So, body focused repetitive behaviors, or BFRBs, as they're oftentimes referred to, really is a collection of a variety of different behaviors that many people engage in. So, depending on the BFRB, the prevalence rate may vary a little bit, but typically somewhere between 2 and 6% is what we're looking at with most of the body focused repetitive behaviors. So, trichotillomania is compulsive hair pulling, which is pulling of hair really anywhere on the body, but most common sites tend to include the scalp, eyelashes, eyebrows, but people can pull from anywhere: pubic area, legs, underarms. So anywhere hair grows is fair game for trichotillomania. Skin picking is also quite common. So we oftentimes see that onset, and most of these conditions, by the way, do tend to have an onset in childhood. So childhood adolescence is where we tend to see it. Typically for trichotillomania, around that 9 to 13 age is where we tend to see it. With skin picking, a little bit sooner. So nail biting, we don't know as much about, but also tends to be a little sooner for onset. Like I said, there's a variety. With skin picking, oftentimes it starts with picking at scabs, mosquito bites, things like that. And this is a behavior that serves a function. And we'll talk a lot about that during this interview. And that's kind of the puzzle that we try to figure out through functional behavioral analysis. What function does this BFRB serve for people? So, and why does it manifest in the way that it does? Well, we don't really know the answer to that. Why does somebody have skin picking, another person has hair pulling, another person has nail biting, another person bites the inside of their cheek, another person engages in all of them, right? So or it's changed throughout their life, or maybe they started off earlier in life, biting their nails, and then they ended up pulling out their eyelashes, and then they ended up having acne later in their teenage years, and then skin picking tended to happen. So BFRBs do travel together oftentimes as well. So, but typically we do see their onset earlier in life. There's exceptions, of course. There is a baby trick where trichotillomania can begin in infancy, or technically, it's anytime, under the age, I think it's 2, I can't remember if it's 2 or 5 now off the top of my head, for it to qualify as baby trick or onset very early, right? So, and we do have instances where people notice these things later on. So, and it can be kind of a slow, gradual progression or a waxing and waning course, what we typically see. Sometimes if there's infection or illness, you can see a very abrupt onset, with these symptoms. So there's no two people who are exactly alike, and that's why really individualizing treatment is important.
So, um, one thing that can be a little bit source of kind of confusion with people is that there are a number of conditions that involve repetitive behaviors, and OCD involves repetitive behaviors. There's repetitive behaviors of tics, self-stimming, self-harm, and also, body dysmorphic disorder. So, can you give us a little clarification about how to kind of just differentiate BFRBs from some of these other conditions?
Sure, I can start. So, first, we want to think about the actual behavior, so how it's carried out. So, with body focused repetitive behaviors, we're seeing sort of like self grooming behaviors that might be difficult to stop or causing some sort of impairment. So we're going to see something involving the skin or the hair, something on the body. Whereas with, for example, obsessive compulsive disorder, we might see compulsions that are involving maybe moving the body, same thing as tics, but they're not sort of these self grooming behaviors that we're looking at. Um, Also, we're thinking about the function. So, with body dysmorphic disorder, for example, someone might be manipulating their looks, but the reason for this is let's think about the kind of core fear with body dysmorphic disorder. I'm not okay, for example, with my nose. Um, or I don't like the shape of my eyes and it really bothers me. It's really much a concern. So maybe that person will try to alter their eyes or their nose um, in order to hide that perceived defect, right? And so they might be um, doing something to alter their appearance, but the function is different here. The function is to hide or change their appearance because of a dislike of that appearance versus with body focused repetitive behaviors, they might serve a different function. And Dr. Reinardy went into this a little bit, but those functions might be to kind of alter mood or emotions, right? It might be soothing. It serves a purpose to uh, perhaps it feels good when they're doing this behavior. They get that sort of relief or release that feels good on their skin or on their fingers. Um, Perhaps it serves to regulate emotions. So if they're like a very sort of more anxious person, a lot of energy, it can kind of soothe them. It can bring that anxiety down. Or if they're bored or tired, it can kind of serve as like a way to stimulate. And so it could also, if we're depressed or sad, right, that might be a sort of a soothing mechanism in order to regulate those emotions in that way. And so we're looking at the function of the behavior and we're also looking at the actual behavior. Is it one of these kind of self grooming behaviors versus not? And the other thing I'll differentiate before Dr. Bernardi can jump in, because there's a lot we can say on this, is self harm, right? So with self harming behaviors, you might see cutting, which is distinct from BFRBs. You might see, for example, like some people even pinch their skin. The function, again, might be to cause kind of harm or pain. And that also can regulate emotions. But self harm is very different than kind of body focused repetitive behaviors. Um, Again, we're looking at the kind of function of the behaviors and how they serve the person. So I'll let Dr. Renardi jump in and add to this.
Yeah, I think when it comes to differential diagnoses, it can get a little difficult
Can.
sometimes. So, the
Mhm.
other thing to remember is sometimes people can have both. People
Yes.
can have skin picking and body
Mhm,
dysmorphic disorder at the same
mhm,
time. And so, the function of the behavior, like Dr. Gola was saying, is oftentimes quite different. Uh, very often, we'll have clients come in with a diagnosis of OCD for compulsive hair pulling or
mhm,
compulsive skin picking, but they actually don't have the symptoms of OCD outside of what's involved with their hair, skin, or nails. And so when it's hair, skin, or nails, when it's focused on the grooming behavior, that's where we're going to go with a diagnosis of a BFRB. When there's other things going on too, like I said, people can have both, but it does get difficult sometimes. We have an entire talk that we give on differential diagnoses because it can get to be a little, muddy sometimes
mhm.
on what's what.
I'll give, one other quick example I'm thinking of. A client who comes in with, a body focused repetitive behavior of, squeezing skin and that might serve to regulate emotions, but there's also a little bit of pain involved, and so, we're seeing some pain that might be a little bit reinforcing, relieving, so similar to a self-harm behavior, but it's serving very much like a BFRB, in that it's involving the skin. There's some sensations that the person sees, in terms of the sight of the blood, or the skin that, is part of the picture, and so here's another example of how those things can be muddled.
So, you know, I often get parents, you know, coming in to see me with their kind of child with, skin picking or hair pulling, and they're pretty desperate. I mean, they see this going on, and get we've got to do something now, and they go out and they buy every fidget toy under the sun, and those help a little bit for a little while, but they don't tend to be enough.
Mhm. Mm.
Um, and what ca let me put what can you do besides buying kind of alternative things to pick
Mhm.
and pull? What's the deal here, folks?
Mhm.
So to
Well,
speak.
there's so much, and again, when we look at our book, if it was like go out and buy a fidget toy, it would be like just a couple pages long, right? So, but this is something I don't even know how many pages this ended up being. We maxed it out, whatever it was. So, just to make sure we could fit it all in,
Yeah.
because the thing that we have to keep in mind is that we're treating the whole child. We're not just treating hair, skin, or nails here. So, and that's where the functional behavioral analysis comes in. Often, but not always, there's a sensory component to that. So if there's a sensory component, that's where the fidget toys and body brushing and things like that, and the little, gimmicky things can be helpful. We oftentimes refer to those as the low-lying fruit. It
Mhm.
doesn't mean that they're bad, but they're oftentimes just not enough.
Mm.
So having sensory substitutes, and in our book, we talk a little bit about treating the whole child. Moving past, it's really hard not to get distracted when hair is missing, or there's a lot of skin damage, or nails are bitten all the way down, toenails and fingernails. It's something that you're in a panic as a parent. I'm a mom. I know that feeling. And so it's something that, but we have to respond in a systematic way, like most things, right? We want to learn how to respond and not just react, throwing up the karate hands at everything or buying every single gadget out there. So it's really looking at our child, and doing what's called a good functional behavioral analysis, or the ABCs, the
Mm.
antecedents, the behavior, and the consequence
Mhm.
is really what we're looking at. And for your child, when do we notice these things happen? And in our children's book, we talk about the 5 W's: the who, what, when, where, and why, right? So, and we have self-monitoring forms and things like that to look at, because for your child, if they're only really engaged in their BFRB at bedtime, but when they're trying to fall asleep, right? Because they're anxious about their day, or they're whatever is going on for them, right? So that doesn't mean that they need need a fidget toy in like every single situation, or they constantly need to be holding it. That's going to be frustrating for
Mhm.
all parties involved, right? So we want to be really systematic to look at when is the behavior showing up, what time of day, in what
Mhm.
circumstances, who are they around, why, right? So and when we talk about why, we have a little acronym that we call SET that we talk about in the book. And the S stands for sensory. Yeah, it's important, but it ain't everything,
Mm.
right? So we want to look at and as far as sensory things go too, if I have a child that's pulling out their eyelashes, right, and really studying them afterwards, poking them to their finger, rubbing them on their lips, poking them to their tongue or biting off the hair root, there's a lot of sensory experience
Mm.
involved with that. So it's not just
Mhm.
tactile. There's a little bit of tactile there, but there's a lot of other forms of sensory input. They're studying it. They're, getting the oral stimulation from it. Sometimes people smell their hair or smell their scabs. The taste is involved. So even with the S of set, there's a lot involved with the
Mm.
sensory. So if we're just throwing a koosh ball at a kid, you'd be like, here, this will fix it.
Mhm.
Probably not, right? So even on the sensory realm, it may not be hitting the target, right? So, so the E, and I'll just cover these real quickly and we can go into more detail. The E stands for the emotional component, right? So how do we take care of this child's emotion? If my child is pulling because they're stressed out at what happened at school that day, again, a sensory component isn't really meeting their emotional needs. That's where the child may need some skills. Maybe they need to learn assertiveness. Maybe it's a lot of the who that's in their life. Maybe they're having a problem with the teacher, or they're really stressed out about a topic, a subject that they're having difficulty learning, or whatever it is. We want to explore that emotional component because that's the function, the self-regulating function that BFRB is trying to serve for them at night. The T is the thought, right? And there's a lot of different thoughts that we have. Sometimes specifically about the hair, skin, or nails, like, oh, that's rough. I need to smooth that out, or that's going to heal faster if I pick it, right? So, or that hair looks different. I need to pull that one out, or that eyelash is pointed off into a direction that I don't want it to go. So we want to examine those types of thoughts. And there's lots of tools for that. But we have to first look at what are the antecedents, what are the
Mhm.
triggers, what does the BFRB itself look like, and what are the consequences of the BFRB? Is this child experiencing a lot of shame? Do they feel like they're being punished, or are they being teased because of their BFRB? So we want to look at those short-term and long-term consequences. Short-term BFRB feels good,
Mhm.
right? It's like scratching poison ivy. You're doing exactly what you think you should be doing in that moment. It tends to be very pleasurable. So we normalize that when we talk to kids. Short-term feels good. Feels like you're doing the right thing.
Mhm.
Long term, yeah, man, that was just starting to grow back. Now I got a bald spot there again, right? So, or my eyelashes are gone. And I know my mom's going to ask me about it, right? So it's something that, and kids feel a lot of pressure. They tend to want to please others.
Mm.
So when they're doing a behavior that they're really having a hard time stopping, but they know they shouldn't do it, we have to be like, oh, it's your body trying to communicate with you, right? So in
Hold on.
treating a BFRB, we're treating the whole person. We're helping the kid understand, look, this serves a function. This is like, it's just a riddle. We just got to figure out what your body's trying to tell you, understand that, and give your body an alternative that actually is going to work, that's meeting that same need that your BFRB is trying to do. So we could say, thanks, but no thanks. I'm going to do this over here instead to get that need met.
I think that's one of the very important, points that you make in your book, is that these are signals from your body. And as I think one of your people that provide a vignette in the book said, you're um, there's simply a strategy, a creative way in which your body is trying to kind of manage some difficult kind of feelings. I think it was kind of crispy. So it begins, if I understand your approach correctly, with how do we build awareness? How do we build self awareness? And
Mhm.
you have different domains in which to explore how the BFRB may be showing up. Do I have that right? Yeah.
Yes.
Um,
Go
and
ahead,
that
Dr.
is,
Gola. Do you want to explain that a
yeah.
little bit more? Like, or maybe even how people can increase awareness?
Yes. So, we can't put in tools, right, as Dr. Reinardy was explaining, is we need to really understand this riddle. We need to figure out this riddle. So we can't start with tools until we understand your riddle. We need to first work with the child and the parent in bringing awareness to their body-focused repetitive behavior. So that means a few things. First, some people pull or pick or do their BFRB a little more automatically. And so they might be doing their homework and or reading and their hands up here. And before they know it, they have a pile of hair on the ground. And so how can we use strategies if they don't know when they're doing it, right? Some people are much more focused pullers. They're in the mirror and they're really pulling or picking on a scab. And some people have a mix of both. So in that respect, we want to help people that are doing this behavior a little more automatically gain awareness. But even the people that are focused pickers or pullers or doing their BFRB in a more focused way, we need to increase awareness of these antecedents, right? The antecedents, behaviors, and consequences. So we want to understand their who, what, where, when, and why, right? And so the way that we do this many ways. Well, one, first we explain this. We teach them that their riddle might be different, and no two people are doing these behaviors for the same reasons. And then we might have them track their behaviors. So we might have them start to catch when they're doing their BFRB. So then they can think about let's start catching the whens, the whys, the wheres, where you do this behavior. So they might have a log, right? So they might be writing it down on a piece of paper. We might use an app or their cell phone. If they're young, their parents will help them catch it, right? We don't expect very young kids to be able to monitor this on their own. And the parent might fill out a log to start to understand the antecedents here. Like, when is it happening? Where is it happening? What are the triggers in terms of their emotions, their thoughts, or their sensations? Does it start, for example, with an itch or a tingle? Is one antecedent the movement, the place of where their hand is? And so we'll have them track. And then there's also other ways we can help them become more aware. And so, for example, we can increase awareness by having them wear, some kids will use jangly bracelets that make noise if they're using their hand in the behavior. So if they're bringing their hand to their eyebrows, eyelashes, head, the jangle might increase the awareness in the moment. Perfume, that could be a bell to help them realize that they're doing the behavior. We talk about the Keen bracelet as a nice tool, habit-aware bracelet that you can program to kind of give you a little buzz, a little alert if you do your BFRB. If it involves kind of a movement of your hand, you can set that. So those might be a few ways to increase awareness. So once we kind of understand their BFRB and they're becoming much more aware of it, their parents becoming aware of it, not in a way of like, oh, hey, you're doing it, stop, but more just like, ooh, we're noticing, we're understanding, we're learning what those antecedents are, then we can start to implement the strategies that will work, the strategies that will target their who, what, where, when, and why. There are sensations, emotions, and thoughts that go into why and where it's occurring, how it's occurring. Mm-hmm.
And
So,
as you go through the workbook too, we have a lot of, I don't know if this comes out on screen, but there's a lot of things to kind of guide parents through and children through. Like, what are the questions to ask? How do we increase that awareness? What are some ideas? What are some, there's lots of fun little exercises and kid-friendly things. We got whichever direction that goes with
Right.
different logs to be able to monitor things. Because this can feel pretty overwhelming, right? So this is something as therapists we've done for a long time. We kind of have this down. We know what to ask. And so we really tried to capture that in the book. What do we ask kids when
Mm-hmm.
we start with them? What are different ways in which kids can log this? And the other important thing to understand, the whole the skill of being able to do a functional behavioral analysis is really important, because what's an antecedent today may not be an antecedent, 3 months from now. Right now, my antecedent could be mom and dad are on vacation in Arizona, and I'm really nervous because I'm in an unfamiliar place. I'm sleeping at, grandma and grandpa's house or aunt and uncle's house. So, and I miss my mom and dad. And that's where my BFRB is showing up. It might show up because I have a math test. It might show up because I'm in a fight with a friend. It might show up because I'm overly tired, right? So, or I've Yeah, like if you're like my 14-year-old daughter, she found an energy drink for the first time in her life the other day, right? And that rocked her little system a little bit. So,
Yeah.
there's lots of different antecedents. And when we understand them with curiosity and compassion, it's not a battle, it's not a fight. And like Dr. Gola was saying too, it's not like, knock it off, stop that, but it's just like, oh, I wonder what your body wants right now.
Mhm.
That's interesting. What do you think's going on? So, what do you think you need right now? Right? Curiosity and compassion rather than punishment.
So I wonder if we could detour for a moment around the issue of kind of motivation, because I generally find that one, younger children, in the kind of 5, 6, 7, 8 range, often aren't really that motivated, you know, to do it, to make a very general statement. And then older children, you know, um, the embarrassment of it is excruciating, and they just don't want to talk about it. It's just like way too much. And um, I wonder what your thoughts are in terms of, it's great when we have a child who says, like, I don't want to be doing this. That's, wonderful. But for some children, one, because of their age, or two, because of the overwhelming embarrassment, it's really, the engagement is challenging. And I wonder, what your thoughts are about how we can kind of overcome those potential barriers, or is there a better way to kind of put it?
Yes. So it's a great question, right? We see that often along many disorders that we see coming in. But certainly body focused repetitive behaviors because again they feel good. They serve a purpose. And sometimes young kids they don't see any impairment. It's not a problem for them. It might be more a problem for their parents. But you're kind of talking about those kids where that there is they sort of do wanna work on the behaviors, but there's embarrassment, it's hard to use the skills, and we talk about it in the book, is like, you can have both types of thoughts. You could say, like, I like doing this, I don't wanna stop," and, like, I see some things that get in the way for me, and, like, I don't like that, my parents are calling me out on it, or, as much as I like it and I don't wanna stop, I'm seeing that maybe somebody's making fun of me or I'm feeling a little embarrassed about my hair loss. And so, one thing we might do if there's enough motivation that a child does want to work on these behaviors, somewhat, then we might use a reward system, right? And the reward system, we're rewarding kids not for resisting the BFRB. We're not rewarding them like for not picking or pulling, but we're rewarding them for using strategies. And that, just like adults, we're all motivated by rewards, right? If it's something that's hard, like if I'm working on exercising more, I want to do it, but that's not alone effective. I'm tired, I have a lot going on, it's hard work, and so, I might wanna give myself a reward, nice, coffee or smoothie after the gym, and so, we're rewarding them for their hard work, we're rewarding them for using strategies, and so that might increase motivation for kids who, do wanna be there, do wanna work on it in some fashion. Um, in terms of barriers of maybe embarrassment that might get in the way, maybe they don't even wanna some people don't wanna talk about the BFRBs. Some kids, they don't wanna talk about it with a therapist, they don't wanna talk about their parents. We might just kind of reduce the shame. So, maybe, we want to first, like, talk about the BFRB, like, we understand this. We can maybe guess what you're thinking, what you're experiencing. That could be a little relieving to know, "Oh, this therapist knows what I'm talking about." This is where we can introduce books, right? Introduce videos, introduce support groups, where the kids can go and meet other kids like them. I would say that most of the kids that I see with BFRBs have not met another person with a BFRB, which is, wild because, they're pretty prevalent, but because they can be hidden, right? People don't tend to talk about them. When I talk about BFRBs in my life, right, in public, most of the time people are like, "What is a BFRB?" or "What's trichotillomania?" But when I explain it, they're like, "Oh," and then usually they have it or somebody else they know has it, but it's not really talked about. So support groups, meeting other kids with BFRBs, reading these wonderful, all these different resources, these books and videos to help kind of reduce the shame. Dr. Reinardy could probably speak a little more to this.
Well, and I think
If I
something
could
that
just,
okay.
Yes.
if I could, one of the things I was really kind of struck with, and it seems to me that really needs to kind of be emphasized to kind of parents and their urgency of the matter, is that we're focusing here on the use of strategies. We are not focusing on
Right.
the kind of pulling per se. We're really focusing and rewarding and putting our attention to the use of strategies. Um, that seemed to me, a simple but just very important point for pa- parents and actually everyone, and therapists alike to kind of keep in mind, because in the urgency of kind of just seeing these things, um, that fundamental principle can get easily thrown out the window.
Mhm.
Yeah,
So I'm sorry.
absolutely. It is. It's missing the forest for the trees, right? So, and I think that it's looking at the BFRB as a signaling system and as a response system for something else that's going on, right? So, and I have kids that I work with. I have a young lady who I work with right now in my office. She came to me because she pulls her eyelashes. She pulled the her bangs, right? So the top of her hair, her eyebrows, and her eyelashes when she first started in treatment. So, and her antecedent was pretty extreme social anxiety. She's a really eccentric, different than the other kids kind of kid, right? So our main focus in treatment is looking at what are her values? What's the type of person that she wants to be? And the type of person that she wants to be is not your stereotypical kid, right? She has really like different, cool interests. And so much of her treatment has been building her self confidence, allowing herself to be who she is, right? So take social risks, talk to other kids in school, right? So now she has a group of friends. She really embraces who she is. She used to hide behind the pillow every single session where she'd hold one of my big pillows in front of her because she was so self-conscious about everything. And so whereas now she's cross-legged, sitting on my, sofa, just as confident as can be, still very eccentric, right? Which I love. And she's learned to love herself because of that. She's grown back her hair on top. She has her eyebrows. We don't have eyelashes. I don't know if we will or won't ever, right? So, and that's okay because the thing that's really most important is her embracing who she is, treating the whole kid, treating the whole person. She's so much happier. And once in a while, if she finds that she needs that coping strategy of pulling her eyelashes, well, that's eyelashes go quick, right? So you can clear out months worth of eyelash growth progress in less than 5 minutes, right? So that's where sometimes it is. We don't measure progress or success on amount of hair or what your skin looks like. We focus on how are you coping overall as a human, right? So, and when we do that, we tend to notice pretty significant reductions in BFRBs. And sometimes that number goes down to zero, right? So, but it doesn't have to be that way in order to have successful treatment. And with this child, that I work with, she comes from a family where everyone is a little bit more stereotypical, kind of traditional. This is what you do to be accepted and you fit in. And so to have this child who's very different, very eccentric, there was a lot of work that the whole family system had to do to allow her to be her. And so, and it also come to a point of acceptance of sometimes eyelashes are there, sometimes they're not. We did have one short bout where she started to pull at her part again, and there was a lot of stress that was going on socially at school. We worked on a lot of assertiveness skills, and guess what? The part filled in, right? So we barely talked about the hair. So because the hair was just a symptom of the social struggles that she was having. And so when we worked on those social struggles and gave her tools, we worked on a lot of DBT types of skills, dialectical behavioral therapy, setting boundaries with others, looking at who's a real friend, who isn't, how can you assert yourself, how can you tell somebody no. And man, that was a game changer for her. And so I think that again, it's so important to do that functional behavioral analysis, and it's hard as a parent not to get caught up in the symptom,
Mhm.
especially when there is progress, right? And you do see that growth, and then they just had a difficult moment, and when they're not, they don't either don't have those skills yet, or they didn't use the skills in the moment, the body's gonna go toward that body-focused repetitive behavior. It's a quick fix, right? So, it's really tempting, for people to engage in, and so it does take a lot, and like Dr. Gola was saying, I think just even talking about that ambivalence about
Mhm.
change in therapy to be like, "Yeah, it kinda works, right? Short term works great. Long term, not so much," right? So and that's where sometimes, working with kids and helping them understand, like, yeah, this is kind of how it works for you and a lot of other people. So, and that's where it's like, would you be interested in learning some
Mhm.
tools that work for the long
Mhm.
term? And not only for your BFRB, but just good emotional coping that's going to serve you in so many other ways of your life. And something that's interesting, Dr. Gola mentioned this, going to conferences. By the way, there's an upcoming conference in May in Chicago through the Picking Me Foundation, and so it's a great thing to be able to go and meet other kids, other parents, other adults who experience a BFRB. That's incredibly healing in and of itself because it's like, wait a second, they're not a bunch of weirdos, right? Like I thought I was going to be judged as or something. And these are actually pretty cool people, pretty normal people. That's healing in and of itself, right? To see that, to experience that, to have friends who also wear little headscarves or they're trying to wear makeup or they just go with the look, right? So and they do have their scabs, they do have their missing nails, missing hair, but yet there's an atmosphere of acceptance and community. That's something in individual therapy. I can give people a lot, but I can't give them
Mhm.
that. So I can give them the psychoeducation, I can give them examples. We do that in the book too. The beginning of every chapter starts with just like me, like I said, the case vignettes, real people, their picture on there, telling their story of their life with the BFRB. So, and guess what? It turned out okay, right? So, it's difficult at times. We get the full human experience. And that's the other thing too is to have realistic expectations for our human life, right? So, and what recovery looks like and what, having a child looks like that not everybody comes in this like predictable package, right? So, none of us do, I don't think. And
You know,
so
it's
there's
very,
a lot of expectation to work through too.
it's striking in the vignettes provided in your book about how most of the people would describe that they felt weird, they
Mm.
felt alone, they felt that there was something wrong with them, and the tremendous relief they felt in having a community, and whether that was through an actual community or learning about it through books or conferences or whatever. It was very kind of striking.
Mhm.
Um,
Yes, I remember the first, BFRB conference I went to years ago, 10 years ago. I remember it just I will never forget this feeling of seeing kids the first day of the conference, and they're feeling timid and shy, and a lot of kids had their head coverings, scarves, hats, um, headbands, things like that, gloves, and then, just very withdrawn, and then the last day of the conference, these kids running around, like, playing with each other, all their, like, head coverings are off because they were with other people like them, and it was just I'll never forget that, like, feeling, that emotion of seeing that. It was amazing. So I think, yeah, we can't oversell that experience, I think.
Yeah, I
yeah,
I think it is. It's so powerful to see kids who haven't been to a swimming pool in years, right? So to go to a conference or go to a retreat and go swimming
Yeah,
together and be
yeah.
having fun and not worrying about what their hair, skin, or nails look like, right? So to be able to share the experiences like, "Oh, do you bite off the hair root too?
Huh,
Oh, yeah, I do
yeah.
that," right? So, and it's something that, again, in individual therapy, there's a lot that we can do. We can give examples. The book, we give the examples too, but I think to join and you're still part of a community, right? Knowing that you're not alone, which I think is tremendously healing. But to go to an event like that, if possible, and people oftentimes are reluctant. They're like, "Oh, I don't know, how's it going to
Mm.
go?" Right? So, but I would encourage people, strongly consider it. And there are videos and stuff out there too. There's a lot now on YouTube, different examples of body focused repetitive behaviors, and that's really powerful, especially for kind of this generation of kids too.
Mm.
That's often their sense of community is online
Right.
community. There are lots of support groups and stuff too, like Dr. Gola said. I think those are all wonderful avenues, and it's a whole other element of recovery and healing beyond hair, skin, or nails. It's something much deeper than that.
And if I can mention one more thing to answer your question regarding parents, right? Um, these things are very healing for parents as well, to meet other parents who are experiencing similar things and to feel um, feel, I think, less alarmed by the behavior, right? So, we talked about parents focusing on the behavior itself. And, I'm a mom. I completely understand. Like, if my kid wakes up with no eyebrows or eyelashes one day, like, it's very alarming. And so, but we find that often it might probably for a lot of kids it backfires to focus too much on the behavior. So if parents, even if a kid is sort of motivated to work on this, if parents are constantly like, "Oh, did you pull today? Oh, I'm noticing, half your eyelashes are missing." Kids can feel pretty self-defensive. It doesn't fly too well for most kids, even those that are motivated, for parents to kind of constantly be on top of them about these behaviors and constantly be noticing, sort of like the trick police, we call it. Don't be the trick police. Um, and so, yeah, so that's part of the reason why we want to focus on the use of the skills itself. One, because that's where we're going to see change in the behavior, change in the relationship with the behavior, but also because it doesn't tend to be super effective to focus too much on the behavior itself. And one of the ways we help parents kind of minimize their own distress about this is to dispel some myths around it, right? So if a parent sees that, they might jump to a lot of conclusions about, what is this? Like, is this self-harm? What does this mean about my kid? And so I think part of the work we're doing is like working with parents to help them feel a little less concerned about the behavior through teaching them a little bit about it and what it functions and how they're kind of not alone. And then, meeting other parents with kids with BFRBs or other adults or kids with BFRBs, I think helps with that a lot. Helps with that normalization and kind of acceptance, I think is the best word here, right?
So, being the kind of trick police is one way in which, parents may inadvertently actually kind of make things worse.
Mhm.
Are there any other kind of, items that parents should be aware of or to be cautious about that might actually backfire and they inadvertently kind of reinforce the BFRBs?
Well, like Dr. Gola said, over attending to the behavior oftentimes will make the behavior worse, right? So it's kind of finding a healthy balance. It doesn't mean you ignore it completely, right? So, but being able to, make more gentle statements about it. So if, you do have and talking to your kid, how do you want me to respond if I notice that you get off the school bus, right? So, and you have a patch of hair missing or you have blood on your shirt, right? So, how can I help you in those situations, right? To know that you're not in trouble, right?
Mhm.
So, I'm not mad at you. So, what can I do to help you? Like, do you want to talk about what happened at school today? So, or when did you notice? And it can be something distressing, like, oh, yeah, I was taking this test and I couldn't think of the answer. And all of a sudden, I started itching. And the next thing I know, I found a scab and then I picked it and then I had blood on my shirt. Oh my God, that was embarrassing, right? So, being able to give your kid that safe space to talk about it if they want to, or, to be like, oh, I noticed, you had blood on your shirt today. Do you want to talk about it? So is something, is there anything I could do? Be like, oh, no, not right now. Right.
Mhm.
So,
Mhm.
okay, I'm asking about it, not in a way that I'm mad or whatever, but, again, curious and compassionate, without over attending to it, focusing on the tools and the skills. Right. So that when a child, was maybe they came, it's like, oh, okay, well, was there anything that helped, or what do you think could help in that situation? So, could you ask a question to your teacher or, afterwards, is there a way for us to work up? Maybe we could do some extra credit, right? Let's look at your thoughts around that. Let's look at the workbook, right? So is there an exercise around that we can use together? So we're not ignoring the child. We're not like, oh my God, what happened to your hair? Right. But it's something that we're finding a balance. We're focusing on skills and strategies. We're providing an atmosphere that if the kid wants to talk about it, they can be like, man, I really want to go to the bathroom and pull my eyelashes right now. So that it's like, what would help? Could we put a reminder on your mirror? Right. So can we leave the door open? What would help you right now? I think that kind of the what would help you right now is a good approach to take. Having the reward system too, especially in the beginning when kids have to do the self-monitoring or things like that that tend to help, that it's like, all right, you know what? I'm so proud of you for doing that. Wow, look at that. This time, going into that test, you did a little relaxation. You asked your teacher for help. Awesome. Let's give you points for that. So, and 10 points equals taco dinner, right? So, and that's what we're focusing on, acquiring those life skills, those emotional coping skills. Eyelashes, fingernails, scabs are going to come and go, right? So, but these skills are what we're really trying to look at in kids who probably are just born a little bit more big wave surfers when it comes to emotions, right? So if we're like, knock it off, ignore that, that's wrong, kids don't really learn how to process their emotions and everything comes out sideways, right? So there's some research on alexithymia and body focused repetitive behaviors where people zip up their emotions too much. They didn't know what to do with them. And then now they can't even identify how they feel, right? So we don't want that outcome. And that's why I love working with kids. So when I have a kid who just started pulling their hair within the last 3 months or picking their skin or biting their nails or biting their cheeks or however their BFRB manifests, we're changing the whole trajectory of what happens. Because I also work with people who've pulled for 40 years, and this is the first time that they've talked about it. This is the first time they've told anybody. Even their spouse of 30 years doesn't know that they engage in a body focused repetitive behavior. They wear their hair in a bun every single day. Nobody's asked, right? So, or they keep an area covered. So, or they're not intimate anymore. And this is where you start to see all of those consequences starting to stack up, where people's lives have really been impacted. And there's research on that too. People who their studying is impacted. They don't go on vacation, like in big numbers of people who report, yeah, I didn't do that in my life. I didn't go to medical school because I knew my BFRB would be too active, right? So I didn't join a sport because I knew I was going to have to wear shorts, right? So there's situations where BFRBs really can influence the different pathways. That's why we focus on values too. And how do we go down that direction? There's lots of examples in the book too of, and cute little illustrations and stuff too. How do we follow our life in the direction of our values with or without our BFRB, right? So get your shoes on, BFRB. We're going to join soccer, right? So it's something that we still have the life that we want, even with our BFRB, right? We're not going to let it get in the way of doing the things that we value most. And by doing that, we tend to engage in our BFRB less because we're living the life that really tends to fill us up, gives us what we need.
You've just referred to personifying BFRBs, which is actually, I find myself perhaps not really aware that that's been a domain where people have personified the kind of the problem. It's, axiomatic in kind of the treatment of OCD to kind of personify the brain bug, the worry monster. But I'm not sure I've heard it being used with kind of BFRBs. And I wonder if you could just talk about how to effectively personify it. And is this somebody we want to boss back? Do we want to befriend it? What do we do with this BFRB?
Yes. Yeah, it's a useful, I think a useful skill that we sort of perhaps borrowed from a lot of the work with OCD. And I think the sort of overall message in our book is we don't have to necessarily like fight with this beast, this BFRB beast, right? And so personifying it by having kids, like in our book, for example, they might draw what their BFRB beast might look like. Maybe they also get a chance to draw how they envision themselves when they feel like they're in a good place with their BFRB. And we use this like example throughout the book. We have some cute cute pictures with the little BFRB beast, and they're like riding in the car together, right? Like towards the end, or thinking about like acceptance and commitment therapy and sort of values. And you're not ditching the monster behind and run them over, right? Like, because that's not really realistic if we think about what this really means, right? Like a lot of people, they live their lives with the BFRB. And, while we hope and would love to see people, really not engaging in their BFRB anymore, again, our goals are to live a life where this feels manageable, right? Like live a life where it's not getting in the way of the things that you care about. It's not, the thing you think about every single day and you're distressed by it. It's like, oh yeah, I have this thing, but because I've been able to learn skills and I'll be able to manage it, like it's kind of just like riding in the passenger seat. So, we talk about it as sort of befriending this beast. And maybe with all the skills, it's gotten smaller. So it doesn't have as loud of a voice. It's not as scary. It's not as like overpowering. It's shrunk, right? The way I like to think about it. Perhaps it's shrunk, but it's still there. And we're sort of like letting it be the passenger for our ride as we lead the life that we want to lead. And it's no longer in charge.
Right. So,
Yeah, I was trying to find examples in the
Yeah.
piece, and we have several examples and illustrations of
mhm,
what feels so scary and bad, and all these things, and we help kids identify that in the beginning.
mhm,
Where's our starting point, right? What's your relationship like with your BFRB? And like most things, yeah, thank you. When we're trying to push it away and we're in this
mhm,
tug of war, and we give the example, in ACT therapy, they talk about passengers on the bus, right? If we're like trying to get to school, but we're constantly pulling over the bus to deal with our unruly passengers on there, we're never going to get to where we want to go. So it's having your BFRB as a passenger, and something that in the beginning feels, that is like, oh, why am I doing this? I hate this about myself. Da, da. But then eventually being able to be like, oh, it's trying to tell me something,
mhm,
right? It's kind of like a friend that just doesn't give you the best advice all the time, right? So it's a signaling system. It's there for a reason. It's knocking, right? We got to pay attention. We got to answer the door and be like, "What do you want? What do you need?" Right? So doesn't always give the best advice for the long term. Short term works, right? But that's how our brains are designed. And so it's something that, okay, long term, we need some other, it's like, oh, thanks for alerting me. I'm probably not going to take that route, but I think I'm going to do this other skill instead, right? So for the long term. So thanks for letting me know. And so it's befriending your beast, having a different relationship with your BFRB. And a lot of times when we work with people too, they're like, you know what? I would have never come into therapy to talk about this, right? The bullying that I'm having in school, or the relationship that I have with my parents, or whatever it is. But because of my BFRB, I'm now attending to that thing, which I now realize is pretty big, right? Like really needed attention. It was really bothering me a lot. I kept trying to shove it away. My BFRB kept bringing it up to the surface, right? So, and trying to soothe it in a temporary way, but it wasn't really fixing the problem. So, and that's where all the tools and the skills come in. Identifying like, oh, I need something, and what tool can at whatever point in my life, what tool do I need, right? So for this particular circumstance.
sure. I'm out of time, but one final question I'd like to ask is how suggestions for parents in particular about how to effectively use this book. I mean, one thought I had in terms of looking at it is it's important not to rush it.
Mhm.
But I'd like your thoughts about how can parents effectively use this book. Um, it's certainly not something that should be rushed, like we've got to get through this,
Huh.
but rather it actually might kind of take several months to go through. But
Yes.
I'd love your thoughts about that.
Yes. So we love if parents can kind of use this as a guide with their children, because then they're with their kids every day. They can they can really help their kids use this book. And so one way parents can use it is to, read and review the chapters and the skills with their kids. And so really, again, we want to be collaborative, right? And we want parents to be collaborative with their kid as well. So not that this is how we're going to do this book. I bought this book for you and, we're going to read it together. But let's be curious and compassionate as parents, the same kind of message that we're trying to deliver. We want parents to be curious and compassionate with their kids. So we have a letter in here describing a little bit of this to parents. When they read the book, they have a bit of a guide. Let's talk with your kids about this. How open is your kid to reading it on their own versus reading it to them, to reading it together? And how old is the kid is another question we want to think about when we think about how we're going to approach this. But, maybe parents will review the chapter with their kid, help them use strategies, have a conversation of like, how can we use this book together? How can I help you monitor and understand your whys? Because we have lots and lots of activities in the book, lots and lots of charts and questions. And so, it's very heavy, workbook focused. And so, parents can be involved as much or as little as, kids might want. Some kids don't really want their parents very involved, and they might use this book on their own. Some kids might really find their parents' guide to be very helpful. And so parents might kind of read the chapters with their kid, take like a skill, one skill a week, maybe 2 skills a week max. And as they start to understand that skill, read that part of the chapter, do those activities, they feel comfortable with that part, they might move on to the next section. And so many ways to do it, kind of really depends on how open a child is and how a parent and a child want to work together. But we definitely encourage parents to kind of be involved because they can be a big help in helping their kids do these skills.
And I think viewing it like seeing the orthodontist, right? It isn't like you go in one time and have this massive adjustment, right? So
Right.
these are chronic conditions, right? So it's something that we have to, just like braces, it's something to be like, okay, we're gonna do these gradual adjustments along the way, right? So we're gonna get kind of things where we need them. We take off the braces, but then there's still maintenance afterwards, right? So we need emotional wellness tools. And I think this is where mental health in general oftentimes gets misguided. It's like brushing your teeth once and expecting to never have a cavity. These are things that we're going to have to continue to practice throughout life, right? And that's a good thing. Brushing your teeth is a good thing, right? We can do that. We can build that into our daily routine. And that's how mental wellness needs to be viewed too. So, and this book is largely about emotional wellness, what that looks like. And when we're practicing good emotional wellness, just like cavities tend to decrease, BFRBs tend to decrease as well.
And one thing I'll add, I know I have, been guilty in the past where I read a self-help book, I get really excited, I do the skills, and then as time goes on, it fades from your mind. So we hope this is a resource, even if you go through it kind of slowly and at your own pace, that you always have and use, right? So skills are fresh in your mind. You can go back and use this as we build and use skills throughout a child's life.
Yeah, um, like so many kind of skills, say athletic skills, if you work with a coach. I work with a swim coach, and at this point, I pretty much know everything my swim coach is going to tell me. Sometimes she comes up with something kind of new, but it's a lot of repetition of do this, do that. Oops, you're doing that again,
Mhm.
and a lot of repetition. So, where can people learn a little bit more about you guys? And we should also just sort of briefly that the book is also, frankly, a good guide for therapists,
Mhm.
in terms of guiding your discussion. It's pretty much kind of laid out there for therapists in terms of kind of how to build a foundation and the sequences that you need to go through to kind of build an effective foundation in terms of dealing with this problem. So it's
Yeah.
but
So we're pretty easy to find, honestly. So if you Google us, I'm at the Lakeside Center for Behavioral Change. Dr. Gola is at the Center for Emotional Health. Greater Philadelphia. And so, and our book is available too. If you go to the Free to Be Me with the BFRB, you can get it through our publisher, Jessica Kingsley. It's available on Amazon and most places where you can buy books. So we tried to keep the prices, the publisher decides on all those things, but it's something that we try to keep very accessible to people. Not everyone's going to be able to come into therapy. We're aware of that. We try to make these skills as accessible as possible. So, and let us know. We're easy to find. Google us, send us an email. So, the book has a ton of information in it. So, it's kind of taking it at whatever pace you need to. Sometimes if you're the type of person like me, I'll fly through a book in the beginning and then I'll go back and actually work it, right? So that's okay too. So, but just, find the pace that's right for you, right for your child. But I think to implement it slowly, like Dr. Gola was saying, is what sets people up for success in the long term, right? So to continue those self-care strategies.
Great. Well, thank you so much, Dr. Reinardy and Dr. Gola for talking to me and for producing such a useful book for all of us.
Thank you so much for having us and giving us opportunity to talk about the book. Those were really wonderful questions, and we appreciate your time.
Thank you.
Thank you for listening to Your Anxious Child. Please leave us a rating and review in iTunes to help us get the word out. If you'd like to learn more and find additional resources, visit us at edwardplimpton.com.